Hi, we'd like to welcome all of our viewers today to Online Church, and we'll be doing a very interesting topic today, which is called vaccines, a discussion on both sides. This will be an interactive topic, and we will be leaving time towards the end of this presentation for a question and answer session with the audience. So please, for those that are on Facebook or whatever social media platform you're on, please post your questions and we'll be happy to answer and go through them with you. So I have today, and I welcome Pastor Kojo Akomeah together with me today, and thank you for your time as well to join us together.
Thank you, Dr. Henry.
Yeah, no problems.
Glad to be here.
Yeah, well, let's get straight into the topic because I'm sure there's a lot to discuss. And for those of you who may have are following us on the Facebook page, I actually posted a pre-talk which does discuss some of the issues in terms of vaccines as well. And you can refer back to that pre-talk later on, or those who you have already viewed it. It gives us a bit more background information about vaccines and what some of the issues are.
All right, let's get into it then.
Yeah.
I'm sure there are lots of questions that will be coming up later. But yeah, why don't we begin by you, because you did a presentation, you gave us a bit of background as to how vaccines work. Do you just want to recap that for those of us who've not actually had a chance to review it?
Yeah, no problem. Well, first of all, I understand vaccines is a very emotional topic. And I think that it's emotional because it's to do with health, and also because it can potentially affect every single person in a population. And also vaccines have a great potential for great good in terms of preventing important diseases. Also has the potential for great harm as well, whether that be on a large level or even to individuals. And so that's why I think vaccines are a very emotional topic. And then just to give a bit of background as to how vaccines work. So vaccines are actually a primer for the body. It's a way that that we can prevent certain diseases. And no doubt with COVID-19 this year, everyone understands what an impact that has had. And we're really searching for that ultimate treatment for COVID-19. A treatment that is able to hopefully wipe it away, but not only wipe it away, but also to prevent the effects of such an important disease on individuals. And so therefore what vaccines are is that they're a way that we can administer a pre-treatment in a way. It primes the body and it gets the body ready, so then when the real disease comes along, you won't be affected by that disease at all. And it only can affect certain diseases, such as infectious ones like COVID-19, which is a small virus particle. Yeah.
Right. But I guess for those of us who are interested in this topic, this particular topic, so you mentioned that this you actually prime the body,
yes,
with some kind of is it inactive agent from the
yes,
last presentation,
yes,
so that the body's actually ready when the real virus actually comes.
Yeah,
the body will be able to tackle it.
Yes, that's right. And it's taken quite a process in order to find, over the many years about how we can actually vaccine against certain diseases. And COVID-19 is a very clever disease in some ways, because the virus itself, we have to really try to find a portion of the virus of which we can administer to people that is hopefully not dangerous, that is very safe, but also has the same effect, and that effect being that it can actually prime the body. Right. And so a lot of the vaccines that have, the vaccine candidates that have been developed by companies around the world, they're actually using new or novel ways in order to fight against coronavirus, because there hasn't actually been any vaccines to a coronavirus like this before. So the leading two candidates actually use quite novel or new techniques in order to deliver this priming kind of agent. Traditionally, we would use an inactivated form of the virus or bacteria, but in COVID-19 it seems that it's possible to do this, but it doesn't seem to be as effective at the moment. So what they're doing is they're wrapping up part of the genetic material into things called viral vectors, or even introducing the genetic material itself, and then introducing that into the body as an injection. And then it seems at this stage that the leading candidate vaccines are ones that you'll need 2 injections between 3 to 4 weeks apart in order to test the body and then give the body a booster later on. And the concern obviously that people have is that having a new or a novel form of vaccine for something like COVID-19 must also have safety issues as well, because it's never been done before and never been tried before on a wide population scale.
Yeah, because I mean, this pandemic hit towards the end of last year, and beginning of this year, you know, it's continued. And usually, when you're trying to actually make sure that you have a vaccine, if you're working through the process, it takes a long time. But here you have, you know, a vaccine developed within months. How can we be sure that it's safe and it's okay?
Yeah, that's right. And I guess that is probably the number one concern on people's minds, because importantly, we're actually giving vaccines to healthy individuals, people who don't have the disease and people who don't have any symptoms or any problems. So if someone already has the disease and you're giving them treatment, then of course, you know, we need to put in all efforts for that. But if you're treating people who are fully well, who don't have any disease or symptoms at all, and trying to give them a preventative agent, then that really has to go the extra level to be safe. So then come back to your question, Pastor Kojo, about how vaccines can possibly be developed in such a short period of time. Traditionally, it is true that vaccines do take between 10 to 15 years to develop.
10 to 15 years.
That's right. And they go through a whole range of phases in order to finally come up to the approval stage and then be available for mass production. And then the question asks, well, how can other vaccines take 10 to 15 years, whereas the COVID-19 vaccine only takes 10 to 15 months or even less? And part of the reason for that is because although some of the leading candidates are new vaccine agents, they have actually been developed already in the laboratory even before COVID-19 hit. So there were some groups around the world who had suspected a pandemic or some kind of disease would come. And so there was already a lot of background development before the COVID-19 pandemic. And then there are various components within the process of how a vaccine is approved and researched, of which can be sped up in certain areas. So for example, a lot of the recruitment of patients, the data analysis, a lot of the administration, a lot of the approvals, a lot of the funding components, those parts can actually be accelerated. So it is possible that some parts of the development process can be compressed or done in parallel, done at the same time.
Right.
But also, having said that, though, there are some components of the vaccine research and approval process that can't be accelerated.
Right.
And so that's why it still has taken a lead time of 6 months or 1 year in order for us to monitor and in order for us to prove effectiveness. And the main two things that we'll be talking a lot about today is this concept of safety and effectiveness. It's got to be safe, but it's got to work as well. And the safety component is something that you can't speed up. You have to monitor people over a period of time just to make sure there aren't any adverse side effects. And those adverse side effects for individuals, if they're really devastating, can completely nullify or completely mean that people do not want to accept a vaccine at all. In a similar way, the effectiveness component also takes time as well, because you have to give people a vaccine, then you have to monitor them over a period of time, let them go about their daily activities in the community, and then kind of see if they're going to be resistant or be protected against the coronavirus. And that also takes time as well. And so when we talk about, how long it takes to develop a vaccine and all the processes and all the steps that it takes, these two components are probably the ones that take the most time and probably the ones that are the most rigorous as well. And we talk about the clinical trials, how there are like phase 1, phase 2, phase 3, and each of these different phases are ones where there's a lot of interest from government agencies, from pharmaceutical companies, but also interest from independent bodies just to make sure and give that extra level of safety and effectiveness just to make sure that this vaccine is actually going to work.
Right. So there's a lot that you said.
Yes.
But I would like to pick up on one thing.
Okay.
Because you said, look, then you have to also go through the process of recruiting patients.
Yes.
So what does that mean? Does that mean you actually test this vaccine on patients?
Yes.
On humans?
Yes.
Is that ethical? Is that ethical at all?
Yeah, the whole vaccine argument raises a lot of ethical issues. One important ethical issue is this issue of testing on human subjects. And it is true that vaccines do have to be tested on human subjects, and they do have to be tested in the population groups as well of which we're targeting. So not only is it humans that it does have to be tested on, but take it to one step further, which raises even more ethical issues, is that we have to also test vaccines on the target populations, on the groups of humans of which may potentially be the most vulnerable, which might include the elderly who have been devastated by COVID-19, potentially children, pregnant women, or people who are compromised in the hospital. There may be testing on that as well. So it's a lot of ethical issues here, which is why this is such a big and emotive topic. But just in response to that, I've listened to a few leading experts around the world about ethics and about some of the challenges that they face. With the ethics of COVID-19 overall, even with the human subject component. First of all people that are recruited onto a clinical trial are fully informed and willing to be part of the trial. Okay. So that is the number one. That they're people who have volunteered, they're happy to be part of the trial, and they understand that there could be potentially side effects or harm.
They're not forced away?
They're not forced, no. They're not forced and they're not coerced. They are fully volunteers, and that's guarded by very strict ethical processes and very strict information and consent as well. Right. Okay. And then the second thing is that they're very, very closely monitored, even more rigorously monitored than the general population when it comes to monitoring for side effects and for other things, just because when it's part of the clinical trial, even the smallest amount of change or even the smallest amount of abnormality is something that the researchers are very interested in. And so they're actually given, in some ways, an extra level of safety in terms of monitoring. This doesn't mean that there won't be any side effects or that that it won't occur. It also doesn't mean that they're fully protected against coronavirus or COVID-19, because this is a trial vaccine. However, there are strict processes when it comes to testing on human subjects. And it's obviously a very difficult topic, because the last thing you want to do is to expose a healthy person to a trial medication which we don't even know works. However, these are processes that need to be gone through before we allow it to go into mass distribution on a population level.
I guess the flip side is what would happen if we couldn't test it on patients, as you call them, volunteers. What would happen if we didn't have a vaccine? I mean, what would happen?
Yeah, that's right. And I guess this is the flip side to the ethical argument, which is really important for us to also recognize, that people often look at one side of the argument being the do no harm component of the ethics. And those ethics are things such as, we shouldn't do harm on anybody. So if we have a treatment or a vaccine which could potentially harm someone, maybe we shouldn't give it at all. So that's one side of the argument, and I completely understand that side of the argument. But then the other side of the argument, which is also equally important, is that if we had potential to be able to treat a large group of people with a treatment that worked, it's also in some ways not ethical if we don't give the treatment. Yeah, and so if there is potential for a treatment to work, and there are testing phases, research phases, and ways that we can prove that it is actually effective, then it's also equally ethical that we give the treatment on a large scale, but obviously at a little bit of risk to a small number of population. And this is where the argument of vaccines really comes into play here, because we've got this risk and this benefit. The risk is that some people could be harmed. It might be a small group of people, but then we've also got this potential for benefit as well. And how big would that benefit be if we're able to protect every single person in an entire country against, let's say, a disease like coronavirus? How great of benefit would that be compared to the risk of potentially a small number of people having some side effects? But, as you can see, it's very hard to weigh those two things up, because on one side of the argument, even if one or two people get very seriously harmed, is it worth taking that risk for whatever benefit you've got on the other side?
Right, okay. So it's not just a black and white issue, there are factors too.
There's a lot of grey, that's right. And maybe this is a good time for us to introduce the concept, because we've got two groups of people here. I really want to move away from the concept of anti and pro-vaxxers, okay? Because that is really said a lot. It's almost as if, like, if you're an anti-vaxxer, then you've got a certain type of belief sets and maybe a certain type of personality or a certain type of way you operate versus a pro-vaxxer, which is different again. And I really want to move away from those two things, because even the World Health Organization doesn't use these terms and doesn't promote these terms because they're so polarizing. What we want to move towards is more of a concept of what I have explained in my pre-talk about vaccine acceptance and vaccine hesitancy. And there are some people who are much more along the line of being more accepting of vaccines and treatment, and some people who are less likely to accept and more hesitant. But majority of people are actually within a spectrum, and they're in a continuum of decision about whether they would or wouldn't accept a treatment. And I think it's more helpful and more productive for us to use these terms because it doesn't have the same emotional kind of views, but also it recognizes what some of the real issues are when it comes to people accepting or being hesitant against a new treatment or against a vaccine, because we then start to explore and unpack what contributes and what makes someone more accepting of a new vaccine treatment and what makes someone less accepting of it. And then we can understand those issues and then be able to work through them.
Right. But either way, the concerns are genuine, though. I mean, if somebody's hesitant or reluctant, it's not because they believe in conspiracy theories, you know.
That's right.
You must admit, there's a lot of talk about, it's all a conspiracy, by the big organization, the government, to try to get us in some way. How would you respond to that?
And I think that's a really good point. And there's no doubt that that people are concerned, particularly from the conspiracy theory point of view, the big organizations and things like that. One of the key issues in vaccine acceptance or vaccine hesitancy is this issue of trust. Okay. How much do we trust either the government agency, the pharmaceutical company, the health organizations? How much do we actually trust them in terms of the information that they're providing, in terms of when they say a vaccine is effective, is it actually effective? What is some of the data behind it? What is the information that is coming out from these groups? That's one side. The other side is that what is the reputation of these organizations as well? So either pharmaceutical companies or even governments, if they're the sort of governments that have been very open, very honest, have shown not only successes but also failures in terms of their treatments, then this is the sort of government that you are more able to trust because they're more open, they're more honest about their data, they're willing to accept that maybe some data shows one thing and another data doesn't show another thing. But on the other hand, if you've got governments who, a lot of cover-up, there's clear mismanagement, pharmaceutical companies that are more concerned about profits, for example, then this can only fuel the doubt that people have in their minds about whether they're trusting or not. And when we talk about conspiracy theories are like, there's a small group of people that are kind of like controlling or in charge of the greater number of people. And although this is possible, that there are smaller groups that are trying to control or trying to give some kind of, enforce some kind of treatment. On another hand, we also need to recognize that, ultimately our governments are run by smaller leaders who are making decisions. But it's important for these leaders to be able to make the balanced decision, and they're very clear and they're very open about the decisions that they're making and the reasonings behind it. And equally, it's also up to us as the population and the people who may ultimately receive the COVID-19 vaccine ourselves, is for us to be fully informed as well, and to be able to take information from the correct and the trustworthy sources, and not ones which may not have the strong backing or the strong background as to where this information comes from.
Okay, so the source of information is very important.
Yes.
And having trust, in governments, governments that have shown themselves to be, transparent.
Yes.
Where they actually publishing all the data and making it available for people to see.
That's right.
Right. But I guess the question is, so can the government actually force us to take this vaccine? A few months ago, did the Prime Minister not say that it was going to be mandatory?
Yeah, that's right.
And then there was an uproar, and then I think he said something else.
Yeah.
But can the government force us?
Yeah, and this is also a very difficult topic for us to get into as well, because, is it possible that governments can say, okay, it's mandatory or you have to take the COVID-19 vaccine or any vaccine?
Yeah.
And very similarly, I think some of the airlines recently made statements about how they said that, you're not allowed to fly or catch a plane unless you take this vaccine as well. And that also has a lot of implications as well.
Yeah. But it's not new though, because in the past, because in some countries, you have to get vaccinated before you can go for different diseases as well.
Yes, that's correct. Yeah, that's right. And also in certain lines of work, it is also virtually mandatory for you to be vaccinated, let's say in healthcare professionals, for example, or if you're being exposed to a high risk. So one interesting example was in the US Army when a few years ago there was an anthrax outbreak. And so the US government made it mandatory for military personnel to be vaccinated against anthrax. And so that also raised a lot of ethical issues as well. So the question comes back to, is it possible for it to be mandatory? And of course it is possible that governments can lay down the law and say that if you're a citizen of our country, then we can mandate that you do a certain type of practice, whether that be vaccination or whatever. In the same way that governments can say it is mandatory for you to pay taxes or to pay speeding fines or whatever. But ethically though, whether that is actually the right thing to do or not is a different kind of discussion. And I think that ethically it is possible that governments can force people to undertake a certain treatment for the greater good. And this is where, once again, the risk-benefit argument comes into it again, where we're talking about the greater good for the population. If there is a disease that is so deadly and, we're so concerned about a certain type of disease, if that disease is rampant and we must therefore take a certain treatment in order to control the disease, it is possible for governments to make that mandatory. However, I think for something like COVID-19, where I think that fortunately the death rates haven't been as high as previously predicted, and we are starting to see some effective treatment for it, I think certain governments are going to take a bit of a softer approach and hopefully strongly encourage vaccinations, particularly in certain groups. But whether that goes another level or not is another story. But there are definitely ways that steps you can do before you get to the compulsory, you have to hold someone down to get a vaccine. There are definitely steps before that. And the steps before that are things such as adequate promotion, making sure that people understand the reasoning why, even saying that, outlining all of the benefits of vaccination and the reasoning why it should be done. And one of the important reasons that they will encourage is that it's not only to protect yourself, but to protect the community as well. Because if enough people in the community are protected against a certain disease, then it means that it won't spread. And so probably encouraging and promoting that kind of line is the way I think that governments will go. But having said that, though, we don't know if all governments will be able to follow that kind of line. Yeah.
Right. So for example, if somebody wants to make a decision whether to accept it or not.
Yes.
Assuming that the government doesn't make it mandatory.
Yes.
So how can I arrive at that decision, on a personal level, whether I'm going to accept this vaccine or not?
Yeah, great. And I think that's a really good question. And it's also one that once again recognises that people are actually on a spectrum of decision, okay?
Yeah.
So just because today you'd say, I'm definitely going to take the COVID-19 vaccine, doesn't mean that, let's say a week from now, that you'll make the same decision. And that obviously is affected by a lot of factors. Right. So in somewhere like Australia, we're very lucky that we don't have a high circulation of COVID-19 at the moment. And so because of that, I think there's going to be a greater number of the population that are going to be a bit more hesitant to take the COVID-19 just because we're not really seeing the effects. But if you go to another country, let's say where COVID-19 is rampant, there are a lot of people, being affected in hospital or even passing away, then there may be more people that are more willing to accept in that situation. So I think that the way we can come to the decision, is to be able to recognise that when we make decisions about certain things, that we do make decisions in context. It depends on our environment, what's around us, the reasoning why we do or don't want to take it. I think that's one important thing, recognizing that we are making decisions based on a context. And the other important point is having good sources of information.
Right.
And that is information sources of which are balanced, which are open, and which are honest. I think that from what I've seen so far in terms of the scientific community, they are doing their very best to provide open disclosure and open open arguments and discussion about how COVID-19, for example, is playing out. So the World Health Organization, the FDA, which is in America, in Australia, they have a similar type of regulatory agents. I think they are doing their very best to provide the data and make it available. But still, having said that though, people can still be influenced easily by, other factors as well, whether that be media, social media, word of mouth, community leaders. So I think that providing each of these channels with the right information, providing the media with the right information, maybe even promoting a balanced view on social media will help us to arrive to the right decision. And then finally, also recognizing that your decision doesn't have to be sealed like straight away. There are people who are going to be open to change, to say that, on one hand, today I don't have enough evidence that the COVID-19 vaccine is going to work, so maybe I'll decide a certain way. Yeah. Whereas on another day, when more information comes to light, where the clinical trials are then ultimately released, where we're able to see more about the outcomes of the trials and whether they work or not, then people maybe at a later time then can make a decision then about the COVID-19 vaccine. So it's also the openness to be able to change as well, and not being too close-minded and say, no means no, or yes means yes. There is a continuum. There is opportunity for you to make a balanced decision when the time comes.
Right. Okay. So if I'm uncertain at the moment, there's no urgency. I mean, I can take my time to review the information.
Yes.
And then come to a decision, an informed decision, as they say.
Yes.
An informed decision.
Yeah, that's right. Yeah.
Okay. So what about those who are eager for the vaccine? Because apparently, we're not going to get it until probably sometime next year.
Next year, yeah.
So if you're eager for the vaccine and you're thinking, when is it going to be made available?
Yeah, that's right. And this is another ethical issue that we're getting into as well, and that's the ethical issue of access, okay? And the access is like, who's going to get the vaccine and who's the priority? This also comes down to distribution and cost, and this is one of the great logistic challenges, particularly with the COVID-19 vaccine, because how can we get it out to so many people quickly? And how can we also prioritize it to the right people? So would it only be, for example, the rich countries that get it, and then we leave a lot of the low socioeconomic countries behind? Is it only, let's say, healthcare workers that get it, and then population don't get it? So so this is another issue once again. Obviously, it's too much for us to be able to talk about it in such a short period of time, but just outlining some of the issues when it comes to access. I think that initially they would like to have the vaccine given, a vaccine like COVID-19, given to the people who are going to benefit the most, okay? So whoever is going to benefit the absolute most are the ones they want to try to give it to first.
Right. Okay.
So this means that we may be prioritizing people such as healthcare workers, those are exposed in endemic areas, and they may get it first. And then, so therefore it's people who sort of need it the most is the priority. And then second of all, it's also how readily available they can get it to those groups as well. And so sometimes it's just going to be a practical issue that, it's going to be just practically some people are able to get it just because they live in certain countries where the delivery is going to be easier. So the rollout will initially be in those countries where they're just more easily able to transport and logistically able to get it. And there's a lot of preparation work at the moment in terms of distributing or potentially distributing the vaccine just to make sure that we can get it to the right places. But for the everyday person though, in terms of maybe young, relatively young people like me and you, unless we are in a particular high risk area, it's going to be, I anticipate it's going to be fairly difficult for us to get the vaccine early on. But having said that though, if there is a need, if all of a sudden there is another outbreak or the pandemic takes off again in certain countries, then we hope and pray that governments will prioritise the access for groups of people that are at high risk and vulnerable.
Right.
Yes.
Yeah, thank you. There's so many questions coming in, and so
Oh yeah, great.
yeah, but I think it's important that we reflect on the spiritual component of this.
Yeah, right. Okay, yes.
Before we answer the questions, because I know there are so many questions coming in.
And we really appreciate that people really like to discuss this topic. And also, just to let you know, we're happy to go extra time rather than just the hour in order to get through as many questions as possible. But I think that it is important to talk about how, when we talk about topics like vaccines, decision making, prevention, that there is actually a spiritual component as well. And so maybe you'd like to elaborate a little bit about some examples in the Bible where people maybe have decided for or against a treatment.
Absolutely, absolutely. One of the most fascinating stories you find in the whole Bible is actually found in Numbers chapter 21. And there's a story of the Israelites. You remember the Israelites, God had rescued them from Egypt. They were slaves in Egypt, and God was taking them to a land that he had promised them. And it's a fascinating story because, they get to the Red Sea and God miraculously parts the Red Sea. I think there's been so many movies made about that. It's actually amazing. But then they cross the Red Sea. They get into this place where they call the wilderness. A barren desert, kind of area where they're walking. But then something strange happens because when they get to this wilderness and they're on their way to the promised land, God asked them to do something. God asked them to go and possess the land, but then the land that he has promised to give them. But when they go and aspire out the land, they're intimidated by the people who live there. They think, these people are bigger than us. We can't overcome them. They're too big for us. And so they retreat. They go back and they start complaining, oh no, why has God brought us here? He's brought us here to kill us. He doesn't love us. He doesn't care about us. So they are murmuring and complaining, and sometimes we do a bit of that.
Yeah, we do.
In spite of all the good things that happen.
Yeah, I know, but we quickly forget the good things that happen. Yeah.
Why has the premier locked us down for months?
That's right.
I can't go anywhere. So we tend to do a bit of complaining, and that's exactly what these Israelites were doing. Now it's very interesting because in the wilderness, obviously they couldn't find any food, and so God was providing food for them. God will actually rain down bread, it's called manna, from heaven, and then God will give them this manna, and they'll wake up in the morning and there's this manna all around. They just pick it up and make it into, bake it or whatever, and eat it. And so these Israelites are being fed food straight from heaven. In the wilderness, God is providing water for them. In the wilderness, God is protecting them from all sorts, but yet they decide to murmur and complain. And this is where the story comes up, because it says here in Numbers chapter 21, verse 4, it says, from Mount Hor they set out by the way of the Red Sea to go around the land of Edom. And the people became impatient on the way, and the people spoke against God and against Moses. Why have you brought us up out of Egypt to die in this wilderness? For there's no food, there's no water, and we loathe this worthless food. So basically what they're saying to God is, look, okay, right, we feel like we were better off in Egypt. We're better off in Egypt because you brought us here and you're feeding us the strange food. In the morning you give us manna, and for brunch you give us manna, for lunch you give us manna, for snacks you give us manna, for supper you give us manna. We're tired of this manna. Don't you have anything else up there? As if this manna. So they complain. And God says, okay, right, what you guys are saying is that you don't want me. You want me to leave you alone. So God decides to leave them alone. And guess what happens? This is where the story is really sad. It says, then the Lord sent fiery serpents. God did not actually send the serpents. The serpents were there all the time, but God had been protecting them from the serpents, but they didn't realize it. So it says, we don't want you, we don't want your food, we don't want anything to do with it. So God withdraws. And these serpents come, and what did they do? It says, they bite the people, and the people begin to die. Now, when they started dying from this fiery serpents, because obviously the inflammation they were causing, was causing a burning sensation, and when people began to die, then they went to Moses and said to Moses, they said to Moses, we have sinned, we're sorry, we shouldn't have spoken against the Lord, against you. Pray to the Lord that he take away the serpents from us. So Moses prayed for the Lord, for the people, and the Lord said to Moses, make a fiery serpent and set it on a pole. And everyone who is bitten, when he sees it, shall live. So verse 9 of chapter 21 says, so Moses made a bronze serpent, set it on a pole, and if a serpent bit anyone, he would look at the bronze serpent and live.
Interesting. Yeah, vaccinating. It's kind of like a vaccine in some ways. It's protecting you against the. It's protecting you against it. So it's so interesting that the Bible has this story. This is amazing.
The Bible is, for every situation we find ourselves in life, the Bible has an answer. And here you have the Israelites. They've been bitten by fiery serpents, and they're dying. Of course, I mean, these serpents are causing fatal injuries. They're dying, and God says, okay, right, put the serpent on the pole. Anybody who's bitten can look at the serpent and live. But there was a problem, you see, because some of them were very sophisticated. They had been to Harvard and they went to Oxford. Instead of saying, can you give me the scientific, I think my mic is coming up. Can you give me the scientific basis for the reason why I should be looking at a bronze serpent on a pole and be healed of a snake bite? Do you know how long it takes to make anti-venom? So this is the rationale, and so they're reasoning, thinking this is not going to work. So imagine somebody being bitten by this serpent, by the snake, and instead of looking at this metal snake put on a pole, they refuse to look because they're looking for the scientific basis on which they should look at this thing and be healed. And so, unfortunately, some of them die, even though there was a treatment for the condition that they were in. I mean, that's a sad story. But those who actually trusted in God and trusted what God had said, looked at that serpent on the pole, and guess what? They looked and they lived. They looked and they lived. In Isaiah chapter 45, verse 22, there it says, "Look to me, all the ends of the earth, for I am God, and there is no other." That's what God says. So those who looked lived. There was nothing special about the bronze serpent on the pole. There was nothing special about it. It was really to do with what you mentioned about trust. Can we trust? We might not be able to trust earthly governments in everything, in all aspects of all the things that they do and say. But if there's one government that we can trust, it is the government of heaven. That's God's government. We can trust God's government. Now, fast forward, hundreds and thousands of years later, there's a man who comes to Jesus and is having a conversation with Jesus. His name is Nicodemus. And he's a sophisticated guy. He's a learned guy. He's wealthy, and he's trying to figure these things out. He's saying, okay, right, all right, so how am I going to be able to be saved? Because he understands that the whole world has been infected by this venom of these fiery serpents. Yes. All of us, it says, all of us have sinned. We've been bitten by that old enemy of God called the dragon, serpent, Satan. And all of us have been infected. And the thing is, all of us are subject to death because of that bite. But then this is what Jesus says. He says, as Moses lifted up the serpent on the pole, so that everyone who looked was saved or lived. In the same way, Jesus says, if the Son of Man is lifted up, and everybody who looks at that Son of Man will be saved. Jesus was talking about himself. He was talking about himself hanging on the cross. And he was saying, if you look at the Son of Man, if you look at Jesus hanging on the cross, and you believe that in spite of what you've done, he can heal and he can forgive, then you will have life. So it's all about trust. It goes back to trust. Do you trust Jesus to forgive you? Do you trust Jesus to heal you? Do you trust Jesus to forgive all your sins and to save you in this kingdom?
Yeah. So when we come down to this, it's really nice you brought in the spiritual component, because when we come down to trust, it doesn't just come down in a Christian sense or in a religious sense or in a spiritual sense, but it also comes down to some of our everyday decisions as well.
Absolutely.
And particularly in our important decisions, whether that be treatments for health or something like that. And it's interesting to see just how how someone can accept a certain type of treatment or a certain type of way depends a lot on trust and sort of evidence as well, isn't it?
Yeah,
so
right. Yes.
We see around us, for example, the Israelites, that when they were in the wilderness, they saw people dying all around them. So they say, well, there's got to be something that we can do.
Yes.
And so in that situation, people would be more willing to trust, because they not only saw people dying around them, but they also saw the effectiveness of the treatment. As they looked at the bronze serpent, they were actually healed. They saw their fellow Israelite being healed, and then they're then able to then more trust in the treatment. And similarly for Nicodemus and for many Christians around the world, they have really seen the benefit of individual lives, of how they have been changed by accepting Jesus into their life, by trusting in what the Bible says, what God says, and how that is a transformative process for people when they've finally taken on, Jesus in their lives and looked to the cross and accepted him. There's benefit, there's great benefit there, and then they see that happening to others, and then they're saying, well, why can't the same thing happen to me as well? So it's that element of who we're trusting and also the evidence that we can see around us.
Exactly, absolutely. And it's interesting because we can choose to take the vaccine or not.
Yes.
It's a choice. God does not force anyone. No one is coerced into a decision. But God loves. And because God loves, he invites us to take this treatment so that we will live. If we decide not to take the COVID-19 vaccine, that's up to us. We can live with those consequences or die with those consequences, either way. But when it comes to this eternal, so to speak, vaccine or treatment, we cannot, we can say no, but we should not say no.
Yes, that's right.
Because it's in our interest.
Yeah, that's right. Okay, well, thank you for sharing with that. Now we are going to be able to answer some of the questions that we have online, and if there are any other questions as well that do come up, we're happy to look at those too. So we have one question from Marion, where she talks about the issues of how vaccines are being developed and the process. And we did talk a little bit about that, in particular about how whether this idea about human testing, for example, is something that is actually ethical or not. And she obviously has concerns about the process. Yeah, that's right. Yeah, that's right. Which I do understand. So I guess the concern is about the process of how vaccines are developed and whether there is sort of human testing involved and whether there is experimentation and that type of thing. And we did address that a little bit before, but it is important to also recognise that in order to advance the treatment, there has to be an element of testing to be done, and it obviously testing only on people who are willing to be actually tested. And it is once again difficult because there is potential for harm, but at the same time there's also potential for great benefit as well. And the only thing that I can say in response to Marion's question is that ethically the potential for benefit has to be also factored into the decision making as the potential for harm. And if the potential for benefit is so great, we can't withhold an effective treatment against one that could potentially cause harm as well. And so that's where I guess the ethics come into it, but whether that's why a lot of these companies are able to get ethical approval for testing treatments such as vaccines or even other medical treatments because of the potential benefit. There has to be a very strong argument for potential benefit before ethical committees allow certain types of treatments to go into testing phase on humans. So yep. And then I guess equally the same person, Marion, also talks about the difficulty of transmission and also does it actually prevent transmission? And Marion also mentions about sort of other ethical components as well. Okay, so let's just talk briefly about transmission, and I think that this is also one of the difficulties that we currently have in terms of where we're at in terms of the testing phase of the vaccine. So in order for a vaccine to be effective, it has to be effective not only in preventing someone getting the disease, but also hopefully preventing the transmission of the disease as well. Right. And this is something we currently don't know at the moment in terms of whether the current leading candidates for the COVID-19 vaccines actually prevent transmission. So it is possible for someone to receive the vaccine, get the virus, but still pass on to someone else. It is still possible because of the way that COVID-19 works is that people don't necessarily have symptoms, and it is still possible for someone to still be transmissible even with the vaccine. And it's something that we don't know yet.
So there's no data at the moment, do you actually?
There's no data on that at the moment, and that's why I think that we do have to be a bit cautious about the vaccines when they do come out.
Right.
That there's no data on that.
Yeah.
There's also no data on whether, at this stage, whether any of the vaccines potentially even can accelerate the inflammatory process in certain individuals, and that's something that people are very concerned about. Maybe there are some subgroups of people, whether that be elderly or immunocompromised, who do receive the vaccine. It is possible that the vaccine could actually accelerate the inflammatory and the disease process. So it means that the second time around, they might get an even worse sort of type of reaction. That is possible as well. And once again, there's no data, enough data on that at the moment. And these are I think that at least these are areas of which research groups recognise. They know that there are unanswered questions, and they're doing their very best in order to find an answer or a solution to these questions. And I really do hope that when the vaccine does roll out, that we get clear communication about issues like this. And you can see that, that there are still a lot of unknowns about new vaccines such as this one for COVID-19.
Absolutely. Yeah. Right, so the questions, let's see, there's one here from Kathleen.
Oh, yes.
So Kathleen says, which vaccine is ethical? How will organizations know you've had it? And does this come under doctor-patient confidentiality? Yeah,
okay. This is, I think there's two parts to this question, just to try to understand the question a little better. I guess she's talking on one hand about the developmental process again, about whether vaccines have been developed in an ethical way.
Yeah, that's right.
And maybe another part of her question is talking about, do we have to disclose we've had the vaccine to organisations just to let them know, I've been vaccinated, therefore I'm allowed to either work or something like that. Or travel or fly, things like that. So maybe I hope that I'm interpreting your question, Kathleen, properly there. I think that once again it comes down to this issue of trust again, in terms of whether we're willing to trust the organisations that are producing these vaccines, whether they have indeed produced it in an ethical way. I think there are concerns about the development of the vaccines. There are some vaccines which have actually used, in the past, have used stem cells or cells that came from embryos or from cells that were potentially going to go on and become babies. There were concerns in the past that there were vaccines that were developed or used these cells in order to develop it, and there were some ethical issues in terms of, are we potentially killing a life because we took the cell from an embryo in order to then experiment on? So that was obviously a concern. There are concerns about animal testing. Obviously, people are concerned about testing treatments and vaccines on animals because we shouldn't be, doing that. And then obviously the whole human testing component too. The only thing that I can say for this in terms of the whether the vaccines have been developed in an ethical way is that there is a process that is involved in terms of the development and then the moving on to clinical trials, and whether we understand the process and then ultimately trust the process is going to be one that we need to think carefully about. If we're concerned about the process and the steps involved within them, and we don't feel that this vaccine has been produced in an ethically way, then that ultimately has to be our decision. But we have to be able to make sure that we have really understood and got the information from the correct source. And then similarly, it comes once again down to risk and benefit, that there will always be some risk and some side effects whenever we develop a new treatment or a new regime, and we have to balance that against the potential benefit. Is the benefit going to be enough to outweigh that? And then going on to the disclosure component in terms of organisations, this has implications in terms of people's work, in terms of even things such as their medical insurance, for example. Do I have to disclose I've had a vaccine or I've had a treatment just in order to fly, in order to work? This is again, once again, another very difficult thing for us to discuss, because ethically, we want to prove people that we are now safe. But at the same time, there is also not necessarily a moral obligation for us to disclose that, I took the vaccine, you didn't, did you do it? Did I not?
Because there's currently a problem.
Yeah.
It's already happening though, isn't it?
Yes.
Because in the state of Victoria, I'm not sure whether it's countrywide
Yes.
or nationwide, but when your child is not actually vaccinated,
Yes.
there's some benefits that they can't actually access.
Yeah, that's correct. In terms of childcare, for example, yeah, and that has raised a lot of issues as well about that. About no jab, no play. They say that you can't join the childcare unless you're vaccinated. Yeah, it's very difficult. I would just say that once again, it's sort of benefit. And I think that if individuals feel that I want to show that I am doing what I feel is the right thing in myself, vaccinating myself to protect myself against the disease, but also to protect the community, then they are at liberty to then be able to disclose that information to whoever agencies are requesting for it. But at the same time, if people want to be more private about this, then there are processes that allow people to maintain a confidentiality in terms of whether they have been vaccinated or not. Right. And it'll take a very, very strict government or a very powerful government in some ways to force people to disclose this sensitive medical information. It'll have to be a very extreme case in ones where the concern of safety, the concern of the disease is so great that they would mandate and they would force people to disclose this information. It'd have to be a very serious situation for that to occur. And, this pandemic has brought to light the potential for how serious these things can be.
Exactly.
Yeah.
Exactly. Right, let's see if there are any other questions.
Yep.
Okay. So, let's see this one here. Okay, I think Kathleen says, he says no, he didn't answer my question. I was trying to see if he would admit there's a chip in it.
Oh, right, okay, sorry. Yeah, I have no information about whether vaccines are used for anything beyond their intended use. Okay. So yeah, I can't make any comments about that. Right, okay. But I guess there are concerns about whether there are any additional substances or whether it could potentially cause more harm. Yeah. I think that, obviously there are people that are concerned about, I guess, once again, the conspiracy theory component about whether vaccines are being given on a mass population. Does it seem suspicious they're given to everybody and maybe there's another agenda behind that? I can't make any more comments about that, but what I can say is that, vaccines are intended to be used to protect against disease and nothing else. So whether there is more to it than that, we can only see.
Okay.
Yeah.
Right, okay. Right, okay, so, Marion, did Marion make a comment? Marion says, say it, aborted babies.
Well, yeah. Yeah, I think we've addressed that already.
You mentioned that, didn't you? Christian Walker says each vaccine company have had many lawsuits against them.
Oh, yeah, okay. I think that this is a good comment that we can just address. Yeah, I do agree that vaccine companies have had issues in the past, and that has unfortunately eroded some of the trust that has been that the community has had. I also do believe that not only individual companies, but even governments and even some health organisations have let the public down in terms of not fully evaluating the safety of vaccines. And I think that is part of the reason why it is such an emotional topic, because a lot of the people who particularly are very emotional or very strong about it either have a personal story or have heard about or very close contact of someone who have been greatly affected by this issue of not being fully safe. And I really am very compassionate towards and empathetic towards these people, because for them to physically see a family member or someone that they know be so greatly affected by a treatment that was supposed to be protective and have devastated individual lives because of it. I guess what I can say in response to that is that we can only learn from mistakes, and we can only hope that companies who do have the lawsuits are ultimately very honest about the outcomes of these lawsuits and outcomes from their mistakes. And they are fully recognising and also acknowledging that there have been mistakes in the past, because there's no doubt what people are concerned when it comes to trust is someone who is covering up, the past. I also think that when it comes now to the COVID-19 vaccine, they're talking about 95% effectiveness or 90% effectiveness, and sometimes these figures are a bit too good to believe. You're thinking, could it really be true that it's this good? And then once again, we have this doubt in our minds about whether these results are trustworthy or not, particularly when they're coming from companies, and all of a sudden we see the share prices go up and all sorts of things like that. It makes us suspicious, and the trust component comes into that once again. So once again, I think that just going back into these issues with lawsuits and trust and things like that, we can only hope and pray that the companies and the governments are doing the right thing in terms of releasing the information. And we also can only trust and pray that people are making an informed and balanced decision when it comes down to this current vaccine or this current treatment. The other thing about vaccines is that there are many different types. There are some treatments that do have a lot of failings. There are some other vaccines that have failed or have issues in the past. But when we come down to another disease, a different treatment, even a different type of mode that this vaccine is being delivered, potentially this vaccine may not, or may even have some of the same safety issues, but it's not necessarily exactly the same as the vaccine that it was before. And so therefore, maybe this new vaccine may not have or shouldn't have the same side effects as another vaccine because it's made in a slightly different way. So once again, it's just understanding the context of the information of where we're getting it from, and also once again the source of the information as well, and once again that trusting component that we have talked about in this talk, and in the spiritual component that you mentioned too. That it does ultimately come down to trust. And if you're not willing to trust the pharmaceutical company or the agent, then ultimately that is going to be your decision. And I don't think that that is a wrong decision to make either, because I don't think someone should be forced to take a treatment when you're not trusting of potentially what it could do or what it's supposed to do.
Yeah, I think it's important that you mentioned that, because Marion was asking who is this man working for or something.
Okay.
So it's important that you...
once again, it comes down to me personally in terms of my background and what I do. And once again, is my information trustworthy as well? And so that's exactly the same issue that we're talking about here.
Right, okay. Any other questions?
Yep. Maybe I might raise another issue that people are concerned about is this issue of effectiveness. And people are saying, well, maybe COVID-19 is not that bad at the moment, and we're seeing a mortality rate or a death rate of 1% or even less. So is it really worthwhile administering a vaccine which could potentially have side effects and issues? And that is quite a common issue that people are asking the question of. If coronavirus or COVID-19 is not that bad, then should we be investing in a vaccine with potential harm? I think that this year we have seen the effect of a world without a treatment for COVID-19. And this year we have seen economies, we have seen health, we have seen environmental effects, we've seen social effects, we've seen a lot of effects of what happens when there is no effective treatment at the moment for COVID-19 and no prevention. I don't think that next year is going to be the same. I don't think that now we're much better in terms of employing certain health policies to control the spread of COVID-19. I think that hospital treatments are much more improved now than it was, let's say, in March this year. I think that there's no doubt the mortality rates are lower and hopefully are continuing to be lower against COVID-19. But on the other hand, I must also say that if there is a potential for us to have a treatment that may return us to a sense of normality, I think that the majority of people would most likely want to at least consider or explore more about whether this treatment will work. That I think that this year has been such an unusual year, and with all the issues that have occurred, I don't think anyone would want to go backwards and back into either lockdown or seeing loved ones pass away or things like that. I don't think anyone would want to see that repeated again, even at a lower level. And so I think that is worth at least considering or being open to what treatments are available, and whether vaccine is one of those treatments is one that I personally think that I would like to strongly consider and explore the options be around it, because I really would like to see, and hopefully would like to see, the end of this pandemic. And hopefully the vaccine may not completely eradicate or get rid of the COVID-19 altogether, and I don't think people are saying that it will, but I think that at least it will do enough to reduce the effect of it, and enough that we can return to a level of whatever normal is nowadays.
Yeah. Well, thanks for saying that. Yeah.
Okay.
So we've got 1 more minute to 11. I'm not sure if any other questions are coming in.
Yeah. Okay.
Yeah. So maybe I just want to emphasize what we talked about in the book of Numbers, chapter 4.
Okay. Sure.
So it's really important that as people weigh the decisions, whether to actually accept this vaccine or not, we need to think about eternity. It's important that we reflect on eternity, because life, there's life after life. There's life after life, and so we need to not only think about the things that are going to make our life here better. We need to think about eternity. And when I talk about eternity, I'm talking about looking at the man on the cross, looking at Jesus, because just as the Israelites were asked to look at the serpent, on the pole, so that they could be saved from the bite. All of us have been bitten by the enemy of God, Satan. And all of us are going to die. But those who put their trust in God by looking at the man on the cross will have life after life. And so it's important that, we prioritize, we make the right decision, and we weigh up, the things, we weigh our decisions and think about the things that are really, really important in terms of eternity.
Yeah, and when I look beyond all the challenges and difficulties of this year, or all the issues in this world as well, I really look forward to a world where we don't have these sort of challenges and ethical challenge that we have. That if there is some way that we can, do away with or get away with this issue of sin, then I think that will be a world that I'm really looking forward to.
So am I. Well, if there are no further questions, then
we'll close with a word of prayer. Would you like to lead us with prayer, Pastor?
Our Father and our God, we thank you so much for being with us, for loving us, and for being so kind to us. We pray that, Lord, as we weigh these issues and think about whether we're going to accept the vaccine or not, we pray that, Lord, you help us, Lord, to think about eternity and to put our trust in the most stable things in life. And there's nothing or no one more stable, more trustworthy than you, Jesus. And so we ask the Father, you will continue to watch over us, keep us close to you, and help us, Lord, to put our trust in you. In Jesus' name we pray. Amen.
Amen.